Good evening, and welcome to tonight's live telephone town hall with Congresswoman Marcy Kaptur, your representative for the 9th District of Ohio. My name is Gordon, and I'll be moderating the conversation tonight. In a few moments, we'll be joined by the Congresswoman. Before we begin, I'd like to explain what will happen in the next hour. If at any point in tonight's call you would like to ask Congresswoman Kaptur a question, simply press *3 on your telephone keypad. Again, that's *3. You will continue to hear the town hall until one of the Congresswoman's staff members can assist you. If you don't have a chance to ask your questions during tonight's call, please note you'll be able to leave a voicemail for Congresswoman Kaptur and her staff at the end of the call simply by remaining on the line. Again, if you would like to ask the Congresswoman a question, please press *3 on your telephone keypad now. With that, please welcome Congresswoman Marcy Kaptur.
Hello, this is Congresswoman Marcy Kaptur, and thank you all for joining us this evening. Our call will focus on protecting and strengthening Medicare and Social Security. We are fortunate to be joined by Max Richtman, President of the National Committee to Preserve Social Security and Medicare. Max is a tireless advocate for senior citizens and on all legislation which impacts the aging population. Thank you, Max, for joining us, and we will hear from him shortly. The way we'll proceed, I'm going to make a small, brief opening statement, and then we'll take 3 initial questions from any of you. Press *3 as was recommended, and then we will go to Mr. Richtman for his statement, and then we will open it up for many, many more questions from our listening audience. Let me begin by saying protecting access to high-quality, affordable health care is one of my highest priorities in Congress, and it's why I support strengthening Medicare and am working to lower the cost of prescription drugs and support innovative policies that keep our families healthy without breaking the bank. Furthermore, I'm a staunch supporter of protecting Social Security for seniors. I vote consistently and take appropriate steps in Congress to assure Social Security remains accessible for future generations to come. It is an earned benefit. I'm actively working to preserve Social Security solvency and repeal the offset that has unfairly burdened so many Ohioans. And I'm a co-lead of legislation called the Social Security 2100 Act, 2100. This bill will increase benefits for current and new beneficiaries. It will protect retirees against inflation and repeal the offset. That bill now has close to 215 co-signers, I believe. We need 218 to bring a bill to the floor. With a new Congress in 2025, I'm hopeful we can get this done. We've been trying a long time. Our nation has made significant strides to strengthen Medicare in recent years, and importantly, with the Inflation Reduction Act, which I supported, Congress has lowered the price of insulin for seniors on Medicare to only $35 a month, an annual savings per retiree of over $420 a year. Additionally, for the first time in our nation's history, Medicare now has the ability to negotiate drug prices to significantly bring down the cost of life-saving prescription drugs. We've also created a new $2,000 out-of-pocket limit on prescription drug costs for Medicare beneficiaries beginning next year in 2025. You want to take a close look at that. And as your member of Congress, I'm working across the aisle in a bipartisan fashion to bring dental, vision, and hearing coverage into Medicare. That, too, is a big fight, but I'm going to continue to push for these reforms until they are a reality. I encourage everyone to start planning now to be prepared for Medicare's open enrollment, which begins on October 15th through December 7th, 2024. I don't know why they chose those particular dates. I would have done it a different way. But anyway, October 15th through December 7th, and during which you may shop for all coverage options. You need to take a look at those. With all the confusing mail, commercials, and seminars, it can really be daunting to find the insurance that is best for you. And fortunately, there are resources in our community like the Ohio's Department of Insurance as well as the Area Office on Aging that can help you navigate this process. You may call the Area Office on Aging of Northwest Ohio at 1-800-472-7277, and you may contact Ohio's Insurance Office directly at 1-800-686-1578. I'll repeat those numbers later in the program, too. And you can make an appointment when you call the Ohio Department of Insurance to meet with an OSHIP, they call it, counselor. Our office is also available to answer questions or point you in the right direction. And always feel free to call us at 1-800-964-4699. That's 1-800-964-4699. Now, I'd like to take 3 questions before I turn it over to Mr. Richtman. And again, I thank him so very, very much for joining us today.
And just a quick reminder. Sure, just a quick reminder that if at any time you want to ask a question, you simply have to press *3 on your telephone. First, we have John in Toledo, Ohio. John, you are live on the call.
Yes, ma'am. I would like to know, how can we deal with insurance when they just drop my prescription? They just say, we're not going to pay for it, and I'm out of luck. And the doctor can't always be an advocate for me.
Right, John, are you a veteran? Hello?
Yes. Hello?
You are a veteran? Are you a veteran, John?
No, ma'am.
You are not a veteran. Okay.
No,
I'll tell you the best thing to do. You can call our office. We'll get into the details, okay? Just call 1-800-964-4699. We can't get into the details of your personal situation over the air, but we're happy to help you out.
All right. Thank you.
You're welcome. Next question.
Up next, we have Joe in Sylvania. Joe, you are live on the call.
Hi, Marcy.
Hi.
I was a public employee for 31 years and never thought and didn't realize that all the time that I also worked from a teenager to in my 20s and now I'm still working. After I retired from being a public employee, that I wasn't going to be able to get my Social Security that I paid into. So you've co-sponsored, as you always do. You're always on our side. The Social Security Fairness Act, H.R. 82, and it has 325 co-sponsors. It has 210 Democrats and 115 Republicans. And we are asking our representatives to go and sign the discharge petition when it becomes available on the House floor on September 10th. So I guess the question is, Marcy, will you sign the discharge petition for us on September 10th?
Oh, yes. I'm a co-sponsor of H.R. 82.
I know you are.
I'm a co-sponsor of that. Yeah. While we've been in our districts, the committees of jurisdiction have finalized everything, and they're going to open the books that we can sign the discharge petition when we go back this coming week. So, yes, you have my word on that.
Up next, we have Margaret in Toledo. Margaret, you are live on the call.
Okay, yes, this is Margaret, and I had a question about cost of medications. I am on 2 that are pretty high cost. One is a proprietary medication called Nupro, and it's a patch, and I have severe muscle-flight syndrome, and I need it every day to help me get through the night, to sleep and that kind of thing. But it is $1,000 every 3 months, and I pay $250 a month for it, at least. Sometimes it's $400, depending on where I'm at in the, the Medicaid or the Medicare, spend down. But and then the other one is I have a steroid medication, the inhaler that I'm sure a lot of seniors are on. That is also expensive. I pay between $50 and $75 for it, and then I forgot about the third one that I have. That one is $75 a pill, and it gets pretty expensive when you're on a fixed income. And I don't know whether Marcy can do anything about those 3 medications or not, but I'd appreciate some help.
Well, first of all, thank you for calling in. The medications you've listed, as far as I could tell, and I don't have all the material in front of me, are not on the list as yet. You mentioned 3. The administration has just gone through the first round of negotiations. I can send you the list of medications that were in the first round, and I know that they're going to do more, all right? So, but the other thing is sometimes the pharmaceutical companies, as your doctor tried to help you, go to the pharmaceutical companies and see if they have any free samples.
Yes,
I don't know if you've tried that.
I don't qualify because of my husband's pension. I'm just a couple dollars over.
Okay, well, the best I can say is that you call us, okay, at 1-800-964-4699. We'll see if there may be local resources available somehow to try to help. You're not a veteran, correct?
25 years.
Ma'am, are you a veteran?
No, I am not.
Okay, just checking.
I was a mental health therapist for 25 years, and my husband was a librarian. I'm a widow.
Oh, I'm sorry. I'm sorry you lost your husband.
Thank you.
But I congratulate you for being strong, and let us see if there's someone at the area office on aging might recommend. I don't have an automatic answer on that one, but they are making progress now in negotiating some of these. And what we can do is take the names of those medicines and send those over to the Department of Health and Human Services and see if they have them on a list, okay? To be negotiated in the future.
Okay, just a quick reminder for everybody, if you'd like to ask a question at any point, you can press *3. I think we've gotten through our first 3, so I don't know, Congressman, if you would like to introduce Max.
Yes, I would like to, at this point, turn the conversation over to just a great, great guy. Max Richtman is president of the National Committee to Preserve Social Security and Medicare, and he is absolutely indefatigable. He is there all the time on behalf of our seniors. And so, Max, why don't you take it from here, and then we'll take more questions.
Great. Well, thank you very much, Congresswoman, for inviting me to your teletown. But before I make a couple of comments, the last caller, I think, was Margaret. You helped her as much as you could on the phone, but it may be that she would benefit from the Inflation Reduction Act. As you know, we'll have a cap on total out-of-pocket costs starting next year, $2,000, and it sounded like she's going to reach that pretty quickly. So that will provide some immediate relief for her, if I understood the question correctly. So, but I just wanted to again thank you for inviting me. Congresswoman, the only thing better than being on a teletown hall with you is being next to you in person, as I've done in the past at town hall meetings in Toledo and not all that long ago in Sandusky, which was not easy to get to, but I was glad I was able to make that town hall meeting and spend a little time with you. So our organization, the Committee to Preserve Social Security and Medicare, was founded in the early 1980s by a former congressman from California by the name of James Roosevelt, and he founded the organization to preserve what he felt was his father's greatest legacy. His father was President Roosevelt, and we've been doing that for all these years, improving and protecting Social Security and Medicare and programs that are so important to seniors. Now, I just wanted to comment. I hope I don't embarrass you, Congresswoman, but you made a statement at the beginning of your opening that you have voted consistently to protect and improve Social Security. Those aren't just idle words. I looked up your score with, we have a scorecard. We send out letters on votes that are important to seniors to all members of the House and the Senate before those votes occur, whether it's a legislation or an amendment to legislation. And we say this one's going to count. And I was able to go back 22 years. And I know you've been in the Congress longer than that, started serving in '83, but your score over the last 22 years, and I just checked it this afternoon, 100%. That's pretty darn good for a member of Congress to have that consistent, as you said, voting record to protect Social Security and Medicare. And what you're doing now, and you brought it up, in supporting as a lead sponsor of the Social Security 2100 Act, is not just improving the program, but making sure it's there into the future. And that would happen by making an adjustment to the cap on wages subject to the payroll tax. It changes a little bit every year. This year it's $168,600, and after that, no more payroll tax. That legislation you propose would start collecting payroll tax again with wages of $400,000 or more per year. That would bring more revenue into the program, extend the solvency beyond the 10 or 11 years that we know the program is solvent based on the trustees of Social Security's report, and allow some funding for improvements, improve the COLA, the minimum benefit, and help resolve the problem that you have been working on for a long time, the government pension offset and the windfall elimination provision. And that is particularly onerous in your district and in the state of Ohio. The windfall elimination provision reduces the caller earlier mentioned this, reduces the earned Social Security benefits of someone who also is a public employee and earns income through that, but also by employment through a employee who was covered by Social Security. So though that and the spousal reduction, the government pension offset, that can be fixed by the Social Security 2100 Act. And I thank you for supporting that and all of the work that you've done to protect and improve both Social Security and Medicare since you've been a member of the House of Representatives.
All right, just another quick reminder. Yes, you can press
star. I was just going to say, Max, I didn't realize that we had gotten 100%. That makes me feel really good.
Well, I could only go back in our records 22 years, and it's probably even beyond that you still have 100%. But I can say definitively that for the last 22 years, you have a perfect record when it comes to votes involving Social Security, Medicare, Older Americans Act, programs that seniors rely on, so that are so important to seniors in your district and around the country.
Just another quick reminder for everyone that you can press *3 at any time to ask a question. Up next, we have Gabriella in Put-in Bay. Gabriella, you are live on the call.
First of all, I want to applaud Congresswoman Kaptur for being so courageous to fight the number one biggest expense that the United States has, which is health care. And, bat for us. I myself am retired, and I'm passionate about health. I am a board-certified doctor, and now I'm retired. I'm living in Put-in Bay because I'm writing a book about health. And the most important thing is education. We can prevent the top 5 or 10 actually causes of disease, especially number 1, cardiovascular disease, number 2, cancer, number 3, diabetes, and then immune diseases, etc. It is up to us to know how to prevent these diseases, and it has to do with the nutrition that we are taking. And I am hoping that Mrs. Kaptur champions this idea of educating the masses, because at the rate we're going to have nothing left. We're spending all this money for things that are preventable. As a matter of fact, it's so dire that they are saying that, for example, in the past 2 years, the Amazon forest is an example. NASA and NOAA evaluated how much CO2 is being produced by the tropical rainforest, the Amazon, and they say it's producing more CO2 than oxygen. How can it be? Why are we destroying the Amazon? Why? Because we are clearing the forest in order to raise animals and food for animals, and the animals are giving us all these diseases. So not only are we destroying our economy, our health, but also the future of our planet. And if you're interested in watching the summary of my book, it's on YouTube. It's called Top Doctors, Health and Beauty Secrets. At the very end of that lecture, the URLs there show you the science, because I cannot go into the details. The champions of this education, which is really for the past 30 years, are from Cornell University and our pride and joy, the Cleveland Clinic. And they have been so good that they actually saved the life of Bill Clinton, because Bill Clinton had an open heart. He had a heart attack. And once he learned this new way of life, he's never had to have a worry about heart attack. And you can see how slender he looks. The other one who's followed this advice is Mike Tyson. He was in terrible shape. And now he's recuperated his health. And now I hope he's going to be the champion again. So this is really up to
Congresswoman?
Yes. The caller made a statement. She didn't have a question, but I would be more than happy to work with all of our hospital systems. And I think that I'll just share a story. I had a doctor come in to see me, a podiatrist. And he said, Congresswoman, I didn't go to medical school to amputate. I'm sick of amputating. I am taking care of so many diabetics, and I have to cut off their limbs. He said, what can we do to help with proper diet, with proper eating the proper foods? What are those? Because we live in such a fast-paced society, people are not getting the nutrients that they need. And so I think we have to simplify it in some way to make it easy for people to absorb. And I know I'm working very hard with our school systems trying to get local fruits and vegetables into the school breakfast and lunches. You can't believe how hard that is. I won't even go into it. But the kids don't like the food, and it isn't the best America can do. I just know that. But I'm not in charge of advice on health. I'm not a health specialist, but I've talked to enough doctors. I would hope our hospital systems could unite across the region. I'd be willing to support their efforts to get proper nutrition and exercise. Just walking in a day can make such a difference, in breathing in clean oxygen. We've brought trees to plant all over our oxygen-short areas of the district. We brought money for that. We're trying, but we have to kind of get in people's consciousness about what is healthy food, what is not, and make it a part of our educational system from early on. So I've heard what the doctor is saying, but I really do think our medical societies need to be more vocal on this to try to help and to guide people down the proper path, not just the latest, nostrum, whatever it is, but actually steps you can take to help yourself.
Just a quick reminder for everybody that you can press *3 at any time to ask a question. Up next, we have Gary in Castalia. Gary, you are live on the call.
Hello, Marcy. This is Gary Rickenbaugh. I'm a member of the Delphi Salaried Retirement Group.
Yes.
when Delphi went into bankruptcy in 2009, they rolled our pensions over to Pension Guarantee Trust, and 6 months later canceled our health care and retirement. I know you helped sponsor the Susan Muffley Act, and it hasn't passed yet, but I'm not sure if they're going to continue down that route, but I'd appreciate any help you can do to help the 20,000 or so Delphi salaried retirees that lost a portion of their pension when they rolled our pensions over to Pension Guarantee Trust. It's really hard. I've got Medicare and no health care and retirement other than Medicare, and whatever supplemental plan I purchase. But I'd appreciate it, and I'm sure all of the 20,000 or so Delphi salaried employees that are left would appreciate any support you could do to help push anything through to try to get our full pensions back.
Gary, I hear you. You know, we were able in the situation with the miners, the iron workers, and the Teamsters to pass the Butch-Lewis Act, but it took us from 2014 until President Biden tucked it in the first bill that he presented to the Congress called the American Rescue Act. The Muffley Act has not been tucked into anything. And I hear from Delphi retirees, believe me, I do. We would have to put it in a bill because they were not covered by any other plan. And unfortunately, the settlement that they put together left you and hundreds of other people out. So I would say what's necessary on the outside is more voices to get more co-sponsors on that bill, like happened with the Butch-Lewis Act. And there were people active in Ohio. Oh my gosh, we worked so hard with them. But it took a president to actually tip the scale in favor of the workers. And believe me, I've heard from a lot of people on this. I'm on the appropriate bills. I would say that one of the most important committees that has to act is what's called the Ways and Means Committee in the Congress, and try to restore these pensions. And the key person on my side of the aisle is a man named Richard Neal of Massachusetts, of Springfield, Massachusetts. And his heart is with you, believe me. We just, at the moment, haven't gotten enough votes on both sides of the aisle.
Up next, we have Margaret in Toledo. Margaret, you are live on the call.
Hi, Ms. Kaptur. How are you this evening?
Good evening. Fine. Hope you are too.
Good. I have a question regarding Social Security. I'm newly retired. I did my thing on the side to help, me get through my later years, whatever. But what is Congress actively doing to revamp the Social Security system? Because you hear reports that all the money's going to be gone, in another 15, 20 years. And, I think it scares people. And
yes,
if they know there's a problem, what are they attempting to do to fix it? And then on top of that, it's interesting that, we're supposed to get a raise next year.
Yes, well, the most important thing for you to know, and I mentioned this in my opening statement, is we have a bill, the Social Security 2100 Act, okay? Social Security 2100 Act, the number on that is HR, that means House Resolution 4583, and it does four things. It provides an across-the-board benefit increase, which is what you're asking for. It has an improved cost of living adjustment that takes into account the true cost seniors incur. It provides a stronger minimum benefit, so the person who works all their life doesn't retire into poverty. And finally, it provides a tax cut for over 12 million Social Security recipients by significantly lowering the tax on their benefits. we have nearly enough to pass it. Nearly enough. And I'm hoping after this next election we'll pick up a few more votes in the House of Representatives so we can move that bill forward. I view that as probably the most important bill right now that affects the majority of the American people who are retired and will be retired. I don't know, Max, if you want to add anything to that.
Yeah, I'd like to just elaborate. You explained all the main provisions perfectly, but listening to the caller talk about Social Security running out of money. Social Security will not run out of money. And I know there are headlines, the program is broke, it's bankrupt, there's no money there, the money was stolen. The truth is there is an issue of long-term solvency. The Congress needs to act. The Social Security 2100 Act that you're the lead sponsor on brings the program into balance, adds more revenue to the program. But it's very important not to buy into, I think the caller mentioned it, people are scared when they hear the program will run out of money. As long as we have people working, paying payroll tax, the program will not run out of money. There's a shortfall. It has to be fixed. It's serious, but that's a very different proposition than the public thinking the program is bankrupt, it has run out of money. That's not going to happen, but the immediacy of it is very clear. The sooner the Congress acts, and I hope you're right, I hope the next Congress will have a composition that will be able to pass your legislation and put the program back on sound footing beyond the next 10 or 11 years, which is very important.
Max, I think also I would want to mention that in early October, a new COLA will be announced, and usually what the Social Security waits until the third quarter of the year is completed in October, and so that will announce the COLA for 2025 and to try to catch up. So that's another thing that's happening, but we need to pass the legislation to deal with the whole system and put it on a sound footing for generations to come.
The COLA that you mentioned will be probably, the estimates I've seen are about 2.6%, maybe 2.7. That's not enough. Your constituents, I'm sure, would to a person would say that it's great to have a COLA, but it's not enough to keep up with inflation as it impacts a Social Security beneficiary. The Social Security 2100 Act that you're sponsoring changes the formula for computing the COLA so that it looks at those goods and services that a senior relies on and puts the proper weight on those items. And that would mean a slightly larger COLA, not a lot, but over time, as you know, it's compounded, so it would make a big difference. So the COLA, it's great that Social Security has a COLA. It needs to be more accurate, and if so, it would be more generous, and the Social Security 2100 Act would do that by implementing what's called a consumer price index for the elderly and measure inflation from the third quarter of one year to the third quarter of the next as it impacts a Social Security beneficiary.
Maybe it's important, Max, thank you for mentioning that. The legislation calls for, and I'll quote these words, protecting retirees against inflation and repealing the offset, which would impact Ohioans. Those two aspects of the Social Security 2100 Act are extraordinarily important for our constituents, and thank you for mentioning that.
Yes.
And just a quick reminder for those still joining us, you can press *3 at any time to ask a question. Up next, we have James in Greytown. James, you are live on the call.
Thank you. Congresswoman Kaptur, I would love to thank you. Hi, how are you tonight?
Very well, thank you. Hope you are too.
I'm doing a lot better than I deserve, I think. But I just want to thank you for your service You've always had my vote. You will continue to have it. I'm a retired member of the Northwest Ohio Building Trades, and you've always supported us. And I'm doing well thanks to you. And that's really all I want to say is thank you so much. And I hope we carry on.
Thank you. Before you get off the line, as a member of the building trades, you have to be very strong and have a very excellent work ethic. Maybe you want to tell our listeners one or two projects that you worked on as you think back, how you helped us build America forward.
Well,
I don't know if you feel.
Well, the building trade, it's honest money. It's hard work, but that's the way I was raised. And it's nice to know that people in Washington and in government in general have our back a lot of times. And you know what? I'm very blessed. And thank you so much. And
Sure, you earned it. You earned it.
Well, we've all earned it. When we work hard, we all earn it. We're all a team if we get on the same page. But the biggest thing is we had a problem with our pension, and thanks to you and Sherrod Brown in the Lewis Act, we regained the cuts that really hit us at the wrong time, as we were approaching retirement, So, thank you once again. I don't have any questions that I need answers for. I just want to thank you.
You are so kind to call in, and I truly appreciate it, especially on this Labor Day week. Thank you so much.
Up next, we have Linda in Rossford. Linda, you are live on the call.
Thank you. Good evening, Ms. Kaptur. Thank you for your time. My question is veteran benefits. My husband happens to be a 100% disabled veteran, and I'm thankful for the benefits that the dependents do receive as of now. But are they looking into anything further as far as benefits for like the dental or optical for the dependents?
Ma'am, first of all, we will thank your husband for his service, and we will take it within our office. One of our staff members will call you regarding your husband's situation and what you need.
Just another quick reminder for everyone, you can press *3 at any time if you'd like to ask a question. Up next, we have Kimberly Pitson. Kimberly, you are live on the call.
Hi. First of all, thank you, Representative Kaptur, for all your hard work for us here in Ohio.
Thank you.
I was lucky enough to meet you once a long time ago when we were nurses striking at St. Lee's. You came down and visited us.
I remember that.
I thank you for that too. My question is about Social Security, because I am retired now, retired nurse, and Social Security and our health care seem to be jiving. It's like, the Social Security goes up a little bit for cost of living, but then our health care goes up a lot. So it doesn't even out sometimes. I was just wondering, and then of course you have to pay taxes on your Social Security. I was just wondering if there's any kind of legislation or any plan in place to maybe kind of even that gap a little bit.
Well, as I mentioned, the Social Security Special Act, H.R. 2100, Social Security 2100 Act, is a pretty important bill that we're hoping to pass. But in the meanwhile, I would say if you call our office at 1-800-964-4699, We'll try to ascertain if there's any aspect of your insurance coverage or your selection of plans. We'll try to direct you to honorable organizations that work with seniors in order to make the bottom line balance a little bit better for you if it can. And then obviously there are bills like the bill that I talked about that would ease the burden on you. And there are various health plans. The enrollment period will begin shortly, again, as I mentioned in my opening statement, starting on October 15th through December 7th. And you can kind of get good advice through the Area Office on Aging and also the Ohio Department of Insurance. They have advisors as well. We can give you those phone numbers if you call us back at 1-800-964-4699. We'll try to direct you so you can look at all of your coverage and your expenses and so forth. And then next year, there's a new $2,000 out-of-pocket limit on prescription drugs. If you take those, that'll help to lower costs. And we can give you advice on that as well.
So, Congresswoman, could I just want to make a comment on Kimberly's question. She made the point, which I tried to make earlier, that the COLA, as great as it is to have a COLA, is often absorbed by out-of-pocket health care costs, where it's the increased Medicare premium or costs that are health care costs that are not covered by Medicare, like vision, dental, hearing. So one thing that your legislation does, as I mentioned earlier, changing the way the formula for the COLA is, the way it's computed, the way it's calculated, it would put more weight on health care than is currently the case, because the current formula looks at how inflation is impacting a wage earner. That's a whole other proposition than how inflation is affecting an older person who has much higher out-of-pocket health care costs. So one of the keys to making sure that the COLA is adequate is to have it reflect out-of-pocket health care costs. And the question that Kimberly asked shows us that is not happening. The COLA is often largely absorbed or eaten up by out-of-pocket health care costs. So I'm hoping that that your bill, the Social Security 2100 Act, when it does pass next year, does become law, will help ease that burden and make sure the COLA is stretched out a little further and does cover more than the increase in health care costs that seniors are experiencing.
Thank you, Matt.
Up next, we have Kyle in Holland. Kyle, you are live on the call.
Good evening, Marcy Kaptur. How are you?
Okay, real well. Good to hear from you.
Yes, thank you. Actually, I'm a friend of Austin. I didn't know if he gave my number, but my question is this. I work in home health. I'm an administrator. I'm over retirement age by a few years, can't retire yet. Wasn't, one of those people who worked for a big company that had, all the retirement benefits and everything like that. So I've had to save and scrimp and do all that. But my question is this, something that upsets me quite a bit, and I see this a lot, is that these new Medicare Advantage plans, why are they being allowed to become so prevalent? Why is the United States government and Medicare allowing private insurances to now take over Medicare?
Well, we get many calls. I hear you, and one of the reasons is obviously we live in a free market economy, but many of these private companies take the word Medicare and they add another word behind it, but it really isn't Medicare. And people, when they try to bid into their insurance in October, if they want to change their plans, a lot of times they believe what these plans say to them, but they really don't study them carefully. So I urge everybody this coming October 15th, just a month from now, a month and a week from now, through December 7th, you can shop for better coverage options. And that's the open enrollment period. So if you're not in the right kind of plan, or it isn't what you thought, we can help you. You can call the Area Office on Aging of Northwest Ohio at 1-800-472-7277, or the Ohio Department of Insurance also has some good counselors. But people think they're signing up for Medicare. They're not. Max, I don't know if you want to add anything.
Yeah, I do, because this is such a big issue, and I'm so glad that the caller, I believe it was Kyle, brought it up. We hear about it over and over again because there is a lot of misinformation out there about Medicare Advantage. You know, you can't watch television for more than half an hour without being bombarded by ads, and you know this, for Medicare Advantage plans. And people, as you were so right, people need to study what these plans provide. If someone likes a Medicare Advantage program and understands the limitations, but still wants to do it, of course, they can do that. But we need a lot more education to ensure beneficiaries know exactly what Medicare Advantage plans provide and what they do not provide. Those plans often have limited provider networks. Once you sign up, you may find out your doctor, your provider is not covered. And here's what's really important, I think. If you want to go back, if you don't like your Medicare Advantage plan and you want to go back into traditional Medicare, you may not be able to do so very easily. It may be impossible to get a supplement if you want to go back into traditional Medicare and buy a Medigap policy, because you then find you have a pre-existing condition and you're stuck. So it's really important that people educate themselves, understand what the Medicare Advantage plan they're looking at, considering does, what it does not do, the limitations if they decide they want to go back to traditional Medicare. And thankfully, the Biden administration has issued some regulations recently to address marketing abuses and overpayments made to Medicare Advantage plans. The whole idea of Medicare Advantage was supposed to be cheaper and to go through private insurance. In fact, the government is overly subsidizing Medicare Advantage, and everybody, not just Medicare people in Medicare Advantage, but people in traditional Medicare are paying for that, for the cost. So again, what you said is so key. Understand what you're getting into if you're looking at and considering a Medicare Advantage plan.
And, you know, I wanted to say, Max, thank you so much. Honestly, this is a big issue. People think it's Medicare because we should make it illegal to use that word in any insurance plan related to seniors, because there's a lot of confusion, and Medicare Advantage is not Medicare. So it's important to know that, and if you have questions about that, call us at 800-964-4699 or call our local Area Office on Aging of Northwest Ohio at 800-472-7277 in order to clarify the difference. A lot of mistakes are made. A lot of mistakes are made on this one. I also wanted to mention, I can't tell you how many veterans I've met who don't know that they qualify for veterans benefits, and they can go to our outpatient clinic on Detroit Avenue in Toledo. They can go to the Defiance Clinic, and they can go to the Sandusky Veterans Home. There is a pharmacy there as well, and they can ask about benefits. You can get, as a vet, you can get your pharmaceuticals if you need them at a much lower price. And I have been surprised how many veterans didn't know that. I don't know why that is, but in my career I've dealt with lots of vets, and so I'm just pointing that out for those who may be listening. At least check into the Department of Veterans Affairs and see what you are eligible for.
Up next, we have Crystal in Toledo. Crystal, you are live on the call.
Well, hello, and thank you so much for inviting me onto this call. Congresswoman, I will vote for you forever if you stay forever. I don't want you to ever retire. You are one truly devoted person, and I believe that you are one of the few that truly care about the people you represent. What I would like
Thank
to
you
talk
for
about,
calling in. I hear my adrenaline for the evening.
just don't ever retire, okay? And then you won't have to deal with any of this. Okay, so what I would like to talk about is that I turned 62 this year and started getting my Social Security. Prior to that, I was getting disability from complications from cancer. And I'm fine. That's not a problem. I don't have a problem with that. But the deal is that I'm raising my grandchildren, and I'm raising 4 grandchildren because of addiction and mental health problems, like many, many other grandparents out here. I can't get any more Social Security because I have them because they're not adopted. That's a very costly thing to do. But I have full legal custody of them. Now, this is a problem for many, many grandparents. There are not enough programs out here. In fact, when I got my Social Security, they cut my SNAP benefits. So now I have to pay for food out of the money that should be helping with our costs of living around the house and the things we need. And this is an issue. And I'm not at the top tier of Social Security because I didn't work for a long time because life happened. So I'm curious as to if anybody has thought about looking into some programs, housing programs, monetary programs. I am involved with the Area Office on Aging and the Kinship Program, but they don't have any monies or any real grants that can help long term. And poverty sucks, I'm not going to lie.
All right. Well, Crystal, first of all, thank you for calling in. We have many, many grandparents raising grandchildren. And though I have not been able to achieve it yet, one of the aspects, I don't know if you own your own home or if you rent, but I really do think this community needs to think hard about how to create housing for grandparents raising grandchildren. Sadly, the drug epidemic and alcoholism have caused grandparents across our region to take responsibility for their grandchildren, and they are heroic. You are heroic for what you are doing. And we don't have many models of that. I've tried to bring home money from the Department of Housing and Urban Development, and I have not been successful in trying to create a complex designed in a way that grandparents could help one another, at least on the shelter aspect. You may not be interested in that, but it's a huge burden for many, many who have both housing expenses and then all these other expenses dealing with raising young children. So what I would suggest, you're connected to the Kinship Navigator, but I think to look at every single thing you're eligible for. For example, the issue of energy bills. Does your home need to be retrofitted so you can save on energy bills? What about food? Are you eligible for food? The Commodity Supplemental Food Program and so forth. We'd have to go through every expense you have. Usually the Area Office on Aging is supposed to be good about that, but I don't know which counselor you've seen. So, again, you can call our office at 1-800-964-4699, or you can call the Northwest Ohio Aging Office or 211 and just, go to different places. I know that the downtown, there are some organizations that help people with food, for example, and we can give you some of those. And even a couple months out of the year, if you get their food delivery, for example, or can pick it up, like Salvation Army, a lot of people don't realize they have help. St. Vincent de Paul has help, kind of put together a yearly budget to help you month by month cut some of the expenses if you haven't already done that.
Up next, we have Sandy in Sandusky. Sandy, you are live on the call.
Hi, Sandy had to step out, so this is his wife, Peggy. And our question, and thank you, Marcy, for your service. Our question is, my husband has all of his quarters for Social Security, and he recently retired from the PERS system, the Ohio Public Retirement System. And when he retired, they cut his Social Security in half. They call it a windfall. And we understand that there are only 6 states in the United States that do that. And we are wondering if your office has worked on this at all.
Let me mention that this is something that we have worked on for a very long time. There are very few states, about what you said, 6, that are impacted, and I'll have Max mention something about it too. But it's very unfair, and that's why the bill that I'm on, HR, it's called the Social Security 2100 Act. And that act, we hope, will be brought up after this next election, and it would get rid of what's called the offset. It would help seniors like your husband, okay? Right now, so we have to repeal the offset. That's never been done, and the reason is because when Social Security was refinanced in the 1980s, about 6 states did not pay into Social Security for their beneficiaries. And what happened was they started using Medicare money, like Ohio, let's say, and Ohio at the time that was done did not pay the federal government for the future costs of Medicare. So they basically were, what would you call them, freeloaders as states, and the other states got mad. Like Michigan paid their money in, but Ohio didn't. So now what's happening, it's falling on the retirees rather than the state of Ohio having been responsible and done what it should have a long time ago. All right? So this bill, 2100, the Social Security 2100 Act, is an effort for us to try to fix that. So that's an important, and I can send you information about that bill. It is very important that we bring that up. I think, Max, tell me, does it have about 215 co-sponsors now?
Right. That's correct.
And all we need is 218 to pass it in the House. So but we haven't been able to crack that number yet.
Up next, we have Henry in Toledo. Henry, you are live on the call.
Hello, Chapter Harry.
Hi, Henry.
And I'm a friend of Patricia Donatelli.
Oh. And
And
your
I
first
know
name
you
is
miss
what?
it. I miss it.
Henry.
Henry.
Henry, you were so good to her. She depended on you.
I miss her. I know you miss her too.
I do. Her husband misses her very much.
I miss her a lot. I miss talking to her. But I just want to say thank you, man, for all you've done for us veterans. And I, for one, really appreciate all you've done over the years for veterans. And I'm real grateful. That's all I want to say.
Henry, I'm so happy to hear from you. You earned your veterans benefits. You earned them.
Yes,
thank you for your service to our country. And what a wonderful man watching over her after her prior husband's death. I mean, you really made a difference in her life.
Father passed, and that's been a long time. And I want to thank you for all you've done for us veterans. That's all I call for. I just said thank you, ma'am. Thank you.
Thank you. Thank you very, very, very much. Max, I think that they want us to wrap up. Is there anything you want to say at this point?
Well, it's been a Congressman a real privilege to be on this call with you, this teletown meeting. I've done, as you know, many of these meetings in person, and teletown meetings, and it's so rare to have callers. I feel like you're part of the family of these people that are calling. So it's something that I'll remember for a very long time, and I do appreciate the chance to be a part of it.
Well, they actually are my family. So it's a privilege to serve them. So many good people here, and oh my goodness, all the things that happen. So I wanted to just reiterate that the bill we've been talking about, Social Security 2100 Act, the bill number is HR 4583. This is the one that's going to fix everything, okay? It's going to provide across-the-board benefit increases for current and new beneficiaries. It'll improve the COLA to parallel the true costs incurred by seniors. There will be a much better minimum benefit, so someone who works their whole life doesn't retire into poverty. And it provides a tax cut for over 12 million Social Security recipients by significantly lowering the tax on their benefits. That's what the new bill will do to make to really refinance Social Security for the next generation. I also wanted to leave phone numbers for some of the callers who we didn't have a chance to call on tonight. Obviously, our office, 1-800-964-4699. Also, the Area Office on Aging is a very good place to go to start. Again, an 800 number, 472-7277. And in terms of bidding on insurance and what kind of insurance plan you want to have or supplemental, the Ohio Department of Insurance. And that number is 1-800-686-1578. I want to remind everybody for your kindness, for your patience, and we will return your calls even if you didn't get a chance to ask them tonight. In other words, I'll have our staff, as they can get to calls during the week, you will receive a call back from us so you're not forgotten. So I just want to thank everyone. Max, thank you for the work you do across our country, and be well in your travels, and let's see if we can't do everything possible to get every Ohio congressman and senator on this bill to allow Social Security 2100, okay, to be passed. It's HR 458, the Social Security 2100 Act. Thank you all so very much for tuning in tonight. You're the best. Have a great week.
Thank you. Thank you.
And just a reminder for everyone, you can leave a voicemail at the end of the call just by staying on the line after we hang up. Thank you, everyone, and have a good evening.